What is vaccination? What are the vaccines that you need to take in pregnancy? When should you take? Why should you take? Let us discuss all about vaccination during pregnancy. Hello everyone, this is Dr. Abinaya Vijayakumar. I am a doctor and a motherhood empowerment coach. For those of you watching me for the first time, I take post-pregnancy classes to pregnant mothers where I teach them how to connect with their baby during the pregnancy using simplified Garbh Sanskar techniques. With no further delay, let's get started. First and foremost, why vaccination is important? Vaccination during pregnancy becomes mandatory because any infection during pregnancy, especially early pregnancy, it can be transferred to the baby and there is a high chance that it will pose serious threat to the baby's health and general well-being. What are all the vaccines to be taken by the women planning for her baby? Let us divide it into two phases. Pre-pregnancy phase while they are planning for the baby, and second is the pregnancy phase. In pre-pregnancy phase, the vaccines that we generally advise are rubella vaccine, that is MMR vaccine, or chickenpox, that is varicella vaccine, flu vaccine, meningococcal vaccine, HPV, that is human papilloma vaccine, etc. If the woman has not taken these vaccines earlier and she is planning for her baby, it is high time that she can get vaccinated with these vaccines. So these are some of the live attenuated vaccine which cannot be given during pregnancy. In pregnancy, we give vaccines which are in toxoid form and not the live attenuated forms. In pre-pregnancy, these are the list of vaccines that the woman has to take and why these vaccines. For example, if the woman had not taken rubella vaccine earlier and if at all during her pregnancy, especially in early pregnancy, if she gets rubella, this is going to put a serious threat towards the baby's well-being. There is a high chance that baby can get anomalous because of the rubella infection. That is the reason we advise MMR or rubella vaccine earlier. The same thing applies to chickenpox as well. If she had not had chickenpox in her early years and she had not taken chickenpox vaccine either, then there is a chance that if she gets chickenpox during her pregnancy, this can pose a threat to her baby's well-being. That's the reason that these vaccines are advised in pre-pregnancy phase. But if these vaccines are missed in pre-pregnancy phase, these vaccines, especially rubella or chickenpox or HPV, cannot be given during pregnancy because these are live attenuated vaccines. So what are the vaccines that can be given during pregnancy? The general and common vaccine that is given throughout the world, first is the tetanus toxoid, TT. Nowadays it is available in the combination form of Tdap, which is tetanus, diphtheria and acellular pertussis. So this vaccine gives protection against three major diseases. Pertussis is nothing but the whooping cough. So when can be these vaccines given in pregnancy? So we advise 2 doses of TD in first time pregnant mothers. So first dose is given as early as 12 weeks or 12 to 16 weeks and the second dose can be given anywhere after 4 to 6 weeks of gap. In second time mothers, if the child is less than 3 years, we advise only 1 booster dose of TD because she has already taken 2 doses earlier. But if the child is more than 3 years, we can give 2 doses of TD just like the first time mothers. Another vaccine which can be given during pregnancy is flu vaccine, which is nothing but influenza vaccine. This can be given anytime during the pregnancy. We usually recommend taking the vaccination as early as before 20 weeks, but anytime if the women had missed taking the vaccinations, she can definitely take it at least by 26 or 28 weeks. There is another set of vaccine which is given when traveling to specific countries. These vaccines include typhoid, yellow fever and Japanese encephalitis. When a pregnant woman is traveling to countries where there is a high risk of these diseases, generally your OB will be advising these vaccines at least 4 to 8 weeks prior to travel. I can't stress this fact enough that vaccination during pregnancy is very, very, very important because if you are not vaccinated with these vaccines, then anytime if you have any infection, it is going to pose a serious threat towards your baby's health. So better not take that risk and take vaccination promptly. So what are the vaccines that you can take after delivery? These includes the same like pre-pregnancy. If you have not taken these vaccines in the pre-pregnancy phase, you can definitely take rubella vaccine, HPV vaccine, hepatitis A or B vaccine, varicella vaccine, which is for chickenpox. So these can be taken after delivery as well. But remember, these cannot be given during pregnancy because these are live attenuated form. No live vaccine can be given during pregnancy. So if you are pregnant and have not taken vaccination so far, It's high time that you call your doctor and book your appointment, and share this with a friend who needs to take her vaccination now in her pregnancy. Hope you like this video. Do like, comment and subscribe to my channel, and press on that notification bell icon to receive more updates on upcoming videos in my channel. Do comment below your doubts about vaccination. I would love to reply to each one of them. Until I meet you in the next video, stay happy, stay mommified.